Okay, I'm going to come into the patient's room, providing patient privacy, making sure I have adequate lighting to perform my physical assessment. Before I meet the patient, I'm going to make sure that I do hand hygiene before I meet the patient. Okay, so I'm going to go ahead and perform hand hygiene, making sure that I also have the appropriate equipment to conduct this physical assessment, including my stethoscope, my tongue depressor, as well as a otoscope with a light source. Okay, so now that I have all of my supplies in the patient's room with me, I'm going to go ahead and enter the patient's room with my freshly washed hands and introduce myself to the patient. Hi, my name's Andrea, and I'm the student nurse today conducting partial physical assessment on you. Hello. And then I'm going to go ahead and look at the patient and examine the overall general appearance, noting any physical deformities of the face, chest, or arms, any physical deformities that I can see, and also noting the patient's overall cleanliness and general appearance, making sure that they are clean and well kept, noting that their clothing is appropriate for this time of season as it is, and also examining just their personal hygiene as well. Okay, and then I'm just going to go ahead and begin the physical assessment by having my patient walk 10 feet. So I'm going to have the patient get up, and I'm going to have the patient walk 10 feet in front of me. While the patient does this, I'm going to be looking at involuntary movements, the patient's range of motion, as well as their overall gait, making sure that they have a steady gait. So Brock, if you could just go ahead and walk 10 steps in front of me. Okay, and then turn around and come back. Okay, and you can go ahead and have a seat again. Okay, and then after I have went ahead and examined the patient's mobility, I'm going to examine the patient's position and posture, noting if they have any hunches, abnormalities in sitting, or any sense of uncomfortableness in how they're sitting. Next, I'm going to go ahead and look at the patient's overall skin, making sure that it is pink, warm, and dry. As I'm examining the patient's skin, face all the way down to their hands, I'm going to make sure that the patient's hands are the same color as the patient's face. Now, going past the skin, I'm going to be looking at the patient's fingernails, making sure that they are clean, intact, free of any abrasions, lesions, scarring, or any questionable appearance of any kind. After I look at the patient's physical appearance and their skin, I'm going to go ahead and examine the patient's affect, the patient's ability to engage with me in this physical assessment. As I have noted, the patient is able to engage with me rather well and is paying attention to the things I'm asking of him. In that, the patient is also able to hear me well, so I note that there is no trouble with hearing or understanding me due to the fact that Brock was able to walk 10 steps without questioning whether I needed to speak up or not. Okay, and then I'm going to go ahead and throughout the physical assessment be listening for the patient's speech, and noticing any slurs perhaps, any lisps, or any abnormalities in the way he is communicating with me. I'm also going to be noting the patient's general nutritional status, and I can see that my patient is a very healthy status as well. And I'm going to continue on to the head and the face of the exam. Okay, and then I'm just going to go ahead and start by looking at the patient's overall general appearance of the head. I can see that there are no abnormalities to be looking at, so I'm going to go ahead and continue on with the palpation of the examination of the head and face. So I'm going to go ahead and start by feeling the scalp, noting for any abrasions, lesions, scarring, sores of any sort. I'm going to be looking at the hair as well, noticing any signs of alopecia or any hair loss concern of any kind. From that, we're going to continue on and feel the cranium, feeling for any masses, abnormalities in the shape of the cranium, the feel of the cranium as well. Moving down, we're going to go ahead and start feeling the temporal artery, and going ahead and feeling slightly for the strong and equal pattern and rhythm of the temporal artery. Okay, and his are strong and equal. And we're going to go ahead and move down to the temporomandibular joint. I'm going to go ahead and have my patient open their mouth and close their mouth so I can feel that joint being used in the way that it opens and closes the mouth. Can you go ahead and open one more time? Okay, thank you. And then after that, we're just going to go ahead and move on to the orientation and level of consciousness of my patient. Since my patient is clearly alert at this time, I'm going to go ahead and ask him what his first, middle, and last name is. Brock, can you go ahead and tell me your first, middle, and last name?
Brock Edward Chaffin.
Okay, and do you know where you are today?
Yes.
Where are you?
I'm at my apartment.
Okay. All right, and then after we have conducted that, we're going to go ahead and ask him perhaps what year it is, so he is aware of time. Brock, can you tell me what year it is?
2013.
Okay, and then after I've examined that, we can go ahead and move on to the eye portion of the examination. So I'm going to go ahead and start with the eyes by examining the eyebrows and the eyelashes, making sure that they are intact, as I see that they are. We're going to go ahead and start with a confrontation test. This is going to measure our peripheral vision. So Brock, if you could just tell me when you see my fingers moving, I'm going to start from the back of your head and move forward, and just tell me yes or no, okay?
Mm-hmm. Yes.
Okay. And then I'm going to move and alternate my fingers. So Brock, go ahead and tell me when you see my fingers.
Yes. Yes.
Okay. And now we tested our peripheral vision. We're going to go ahead and continue on by testing the 6 cardinal phases of gaze. All right, and Brock, you're just going to go ahead and follow my finger. I'm going to make it in the shape of an H, and you can just follow it, okay?
Mm-hmm.
Okay, and these are also testing our cranial nerves for function as well, and I can see that those are also intact. In addition to this, I'm going to go ahead and grab my light source. And I'm going to shine my light into Brock's eye, either the right or the left one. I'm going to be looking at the constriction of the pupils in both eyes as I shine the light twice. So I'm going to shine the light in your eye. Okay, and I'm noticing that this eye has pupillary constriction. Now I'm going to shine the light in the eye again and notice in the opposite eye of pupil constriction as well. Okay, and he does as well. So we're going to go ahead and continue on, and we're going to palpate and inspect the eyes. So I'm going to pull down slightly on the lower eyelids, exposing the conjunctiva of the eyes, noticing that they are reddened, pink coloring, and that there is no abnormal discharge, and there is no whiteness of the conjunctiva, as that might indicate an infection. Okay, and then I'm just going to continue on by examining the sclera of the eye with my light source. So I'm just going to open your eye slightly. Okay, and I'm looking at the sclera, noting any yellowing. We want to make sure that the sclera is free of jaundice, so we want to make sure that that eye is a nice white, clear color. Okay, and then looking at from an angle, I'm going to be looking at the cornea, noticing that it is free of any lesions, abrasions, or foreign bodies. Next, we're going to be looking at the irises, and we're going to be doing these in both eyes, comparing and contrasting both eyes together. Okay, and I'm noticing that his irises are a hazel color. We also want to make sure that at this time when we check for the irises, we can also indicate contact lenses, as that might change the color of the iris. And then we're going to look at the pupil constriction again and note that his eyes are, and the pupils I'm noting are equal and reactive to light, and they are also accommodated. Okay, and then after I've finished with the eye exam, I'm going to continue on with the ear exam as well. And now that I have grabbed my otoscope, we're going to look at the overall general appearance of the eye, or of the ear. So looking at the outer, inspecting the outer part of the ear, we want to make sure that the ear looks clean, free of any debris. And we want to go ahead and test the elasticity of the ear by possibly tugging on the pinna of the ear and pulling slightly back and working our way down. Maybe bending the ear over and having the ear move back so we can see the elasticity of the ear. Now that I'm going to go ahead and take my otoscope, and I'm just going to go ahead and reinforce the safety, and by putting my fingers up against his jawline so that I don't advance the otoscope too far. And I'm going to look in, noticing the ear canal, seeing that it's free of any foreign bodies, as well as it is pink and not a red in color, as that would also indicate an infection. Okay, we're going to continue on by looking at the tympanic membrane. And noticing this should be a clear pearly white color. If it is swollen or reddened, that could indicate a possible infection as well. And we're going to compare and contrast with both ears as well. Okay, and now that we have finished the ear portion, we're going to go ahead and continue on to the nose portion. Okay, and then I'm going to go ahead and have Brock stay the way he is, and I'm going to compare both sides of the nose, testing their symmetry. And at this time I can also look at his face for symmetry as well. I'm not noticing any abnormalities, signs of possible stroke or anything like that. Both sides of the nose seem to be very symmetrical. There are no lesions, abrasions, or piercings of any kind, so that indicates that I can go ahead and to examine the patency of the nose. So I'm just going to go ahead and have you occlude one side of your nostril and breathe out for me and back in. Okay, and do it with the other side of the nostril. And I'm also noting that his nose is patent. And now that I have checked the patency, we're going to continue on, and I'm going to bring out my light source again, and we're going to be looking at the internal structures of the nasal cavity. So I'm just going to have you bend your head slightly back. I'm going to put my 4 fingers up on your forehead and bring your nose up slightly with my thumb. Okay? And as I'm looking up through the nose, I'm noticing the mucous membranes are clear. There is no sign of discharge that should indicate any cause of concern. I'm going to be looking at the septum, noting any signs of deviation, any soreness, redness. And lastly, I'm going to be looking at the turbinates. We want to be careful not to advance our light source too far. We don't want to cause irritation to the turbinates and cause them to bleed. So we're just going to look at those and note that they are pink and they do not appear reddened or swollen. Okay, good. And they appear just fine. Okay, so now that we have finished that portion, we're going to go ahead and continue on with the oral cavity of the examination. I'm going to first inspect the outer appearance of the oral cavity, looking at the lips, making notes of any cracks, discoloration of the lips, any sores possibly around the lips. Okay, and then after I have noted that, we're going to go ahead and look inside of the oral cavity. If you could just go ahead and open up for me. Okay, and with my light source, I'm going to be looking at the buccal mucosa, as it is white. I'm going to be looking at the gums, making sure they are not bleeding, looking at the teeth, noting any abnormalities, perhaps later questioning about his oral care. Okay, and we're going to be looking at the tongue, making sure it's free of any lesions, sores, or abnormal masses. Okay, and if you could just lift your tongue up to the top of your mouth, I'm going to be looking at the base of the mouth, the floor of the mouth, and I'm going to be noticing any signs for reddened or discoloration or discharge as well. At this time, I'm going to have to take a look further back into my patient's mouth, looking for the palate as well as the uvula, and having him exercise that so that I could see that the uvula is fully functioning. So if you could just go ahead and open your mouth one more time for me. Okay, I'm noticing the tonsils. The tonsils are grade 1. Okay, and I have located the palate as well as the uvula. And can you make a high-pitched sound for me, please? Put your tongue down. Okay, and make a low-pitched sound. Okay, and I can see the uvula vibrating back and forth with that as well. Okay, and then after I have examined that, we are going to go ahead and continue on with the rest of the assessment. And I'm going to bring out my tongue depressor and have my patient say ah, and that can also test for cranial nerves as well, testing that they are fully functioning. Okay, so I've grabbed my tongue depressor, and I'm just going to go ahead and first test my patient's gag reflex. So I'm going to have my patient stick out his tongue. Okay, and my patient does have a gag reflex. That also indicates intact cranial function with certain cranial nerves as well. Now I'm going to have my patient say ah. Can you say ah for me?
Ah.
Okay, and this brings up the uvula and brings up the tonsils, and I can also get a better look for those as well. Now I'm going to test him sticking out his tongue, which can also indicate intact cranial nerves as well. Go ahead and stick out your tongue for me. Okay, great, thank you. You can put it back in. Okay, now that I've finished this portion of the examination, we're going to continue on by examining the neck of the patient. I'm going to first go ahead and inspect the overall general appearance of my patient, noting any abnormal masses, any abnormal discoloration, rashes, or swelling of any sort. I see that my patient does not have any masses, soreness, or swelling at all. So then I'm going to go ahead and feel for any enlarged or engorged lymph nodes. So I'm going to go ahead and start by the front, feeling for any lymph nodes, moving my way front, okay, and then behind the ears, down the back of the neck, and coming back up to the front again. Okay, and he does not have any swollen lymph nodes or areas of concern in relation to his lymph nodes. So then we're going to go ahead and we're going to locate his trachea and also his thyroid as well. So I'm going to get behind the patient and I'm going to feel for his Adam's apple, and right behind that I'm going to feel his trachea, and slightly upward I should be able to feel his thyroid. Okay? Alright, and then after I have examined that, we're going to go ahead and look at his chest as well. But before I do that, we're going to test his strength of his neck muscles by doing a range of motion exercise for me, as well as doing a muscle test for me. Okay, so can you go ahead and tilt your head to one side for me, Brock? Tilt your head to the other side. Tilt your head forward, and then backwards. Excellent. Okay, and can you push up against my hand? Okay, push back. Push against the side of my hand. Okay, and push. Alright, and now I can see that his range of motion is full range of motion, and his neck muscles are functioning just well. Alright, and then now we can go ahead and continue on to the chest portion of the exercise. So I'm going to go ahead and look at his overall chest cavity, noting any abnormal changes, any asymmetry from one side of the muscles to the other. Okay, so I'm just comparing and contrasting. I'm not noticing any abnormal masses. He appears to be symmetrical, and so we're going to go ahead and we're going to test for his percussions of his chest. Okay, so with that, I'm just going to go ahead and place my middle finger up against his chest, and I should be hearing hollow sounds. Okay, and I hear hollow sounds. If you were not hollow, I would be hearing a more dull pattern, and that would indicate that I am on a bony prominence. Okay, and so after I have examined the auscultation of his chest, we're going to continue on by checking the exasperation of his lungs to make sure that they are equal. Okay, so Brock, can you go ahead and just breathe out for me? And take one more nice big deep breath. One more. Okay, and I'm not noticing any abnormalities compared to each side of the lung. Alright, and so I'm just going to go ahead and listen to the front of his lungs as well as listen to the back. I'm actually going to start in the back of his lungs, and I'm going to ask him to say a letter, and this will allow me to, this should be absent and I should be able to hear what he is saying. Okay, Brock, I'm going to have you say the letter E, and every time I touch you with my diaphragm, I need you to say the letter E, okay?
E. 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 E.
Okay, and I couldn't hear him, but I could see that his mouth was moving, which would indicate that there are no areas of concern or abnormalities with this portion of the exam. Now I'm going to go ahead and do an exam where I am testing to hear the vibration of what he is saying. I'm going to have him say the word, the numbers 99, and I'm going to feel with his chest to see if I can feel those vibrations.
99, 99, 99, 99.
Okay. Okay, go ahead.
99, 99, 99.
Okay, good. And then I'm going to have Brock say 1, 2, 3, but in a whisper tone, and I'm going to listen from behind him, and I should not be able to hear him.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
And this indicates a whispered perloquy, and previously I was examining him for a bronchophony and egophony. All right, so we're going to continue on with the heart portion of the exam, and I'm going to listen by listening to all 4 quadrants of the heart. This is going to include the apical, tricuspid, apical, pulmonic, tricuspid, and mitral valve. And I'm going to be listening for the mitral for a whole 1 minute, okay? And Brock, I'm just going to be listening to your heart here real quick, so you don't need to do anything for me. All right. And right before we end this physical assessment, I'm going to go ahead and explain to Brock the purpose of a Snellen chart. And I'm going to have him cover one eye. And this is where I would have my poster up behind me on a wall. And I would have Brock read the poster, starting with the largest letter first at the top and working his way down to be able to read that. And that would check his visual acuity. Okay, and so I would just have you cover one eye. You don't have to do it right now. I'm just going to go ahead and explain it to you. You would cover one eye, and then you would go ahead and read my chart, and you would do the opposite with the other eye, okay? All right, and then lastly, I would like to perform one last test of his hearing. So I'm going to go ahead and tell Brock a 2-syllable word and occlude his hearing, and I'm going to have him repeat the word to me to make sure that his hearing is also intact, okay? So I'm going to go ahead and I'm going to occlude your ear, and I'm going to tell you a word, okay? And you can just go ahead and repeat it to me. Apple.
Apple.
Okay, and I'm going to move around you here real quick. I'm going to say another word. Baseball.
Baseball.
All right, excellent. All right, and that concludes our partial examination for today. I'd like to thank you for being a patient for me today. Thank you very much. And that is it. Thank you.